topics.
All right, well, we're awaiting Mr. Lamb. And we have Barbara Fagan joining us. Hello, Miss Fagan, how are you? Anyway, we are awaiting Mr. Lamb, but why don't we go ahead and I will call to order this meeting of the Health and Human Services Board for November 18th. It looks like everyone is here except Mr. Lamb and Supervisor Steen, who is having his knee replaced today, so we'll excuse him. Do you need anything else, Chris?
Nope.
Okay, all right. We have minutes from our October 28th meeting. I would like a motion to approve the minutes. Supervisor Bjork moves. Is there a second? Supervisor Cromrie seconds. Any additions or corrections? If not, all in favor signify by saying aye.
Aye.
Aye. Opposed? Minutes of the Dunn County Health and Human Services Board for October 28th are approved. Krista, do we have any public comment?
There is no public comment.
No public comment. All right. Next item on the agenda is our December meeting date. We moved it to the 16th for the December holidays. That's still okay with everyone?
It's good.
Okay, we'll see you again then on the 16th. And Mr. Quinn has joined us, Mr. Lamb has joined us for the record. Hi, Bill, welcome. Greg Quinn has joined us, and so you are up next, Greg.
All right, thank you. Can everyone hear me?
Yes.
Thumbs up. All right, good evening. I had just emailed the full packet out, and I know it's late. I didn't get my packet out for this month's meeting in the mailing last week. I can share my screen if that would be appropriate, and I have the items here. Let me.
That would be great, Greg.
All right. Just let me know when you're able to see document the Veteran Service Office letterhead.
Looks good to me, Greg.
Okay, so the first part of my report will be going through our local activities for the month of October. Well, and I included some November activities because it very significant, of course, with Veterans Day on the 11th of November. So I figured I'd go ahead and update on a few of those activities. So this last month, I met with, did a Zoom meeting with a group that I've just become familiar with them because one of our Veteran Service Commissioners, Kathleen Cunduff, is part of the group and represents the Service Commission as well as veteran and being a female veteran. And so she had requested I provide a presentation on our office activities. And for those of you not familiar with the Menominee Cares group, I had them give me a little bit of information on their background, and really what their vision is building a welcoming, safe, and inclusive community here in Menominee. And so they have a variety of participants in their groups. So I just presented on the activities of our office and really what our foundation is and how we benefit kind of all of what their vision is as an office and a representative of the County of Dunn. And then we had worked with the neighbors of Dunn County. We've been doing it ever since I've been in this position for 10 years. Outside of last year, we weren't able to do a celebration for the veterans over at the neighbors of Dunn County, of course, because of COVID. This year it was nice. They were able to accommodate, and so we were able to do an in-person celebration. And they had a change of the guard where I typically have always worked with Sally Rock, who had recently retired, who'd always done an incredible job. And they have another person kind of taking the reins with that, Lissa, and she did a great job getting the involvement to the veterans and family, and so we just have it typically go through a short celebration to kind of take pause and recognize them and their efforts. So that I thought that was nice, and half a step towards normalcy, I guess, by doing that. And of course, all the COVID protective measures are in place, of course, but it was nice to see their family there, as well as the veterans that participated that are there at the neighbors. And then that evening on Veterans Day, I'd met with, I got a late request to meet with a local Cub Scout group, and my personal philosophy is always the earlier the better. Earlier you can start to influence and talk with individuals about the decisions that they make and how that'll shape the rest of their lives. And so it was nice to have a captive audience of some Cub Scouts to kind of talk about service and broadly from that, not just service to your country, because service to your country can look in a whole different ways. Like everybody that's participating tonight is, local community, but you're also serving your country by being good stewards of federal money and state money. And so it was nice to talk to the young kids and hopefully they left with something positive other than, if you're in the military, you can wear a cool uniform, but they're a bunch of youngsters. So it was nice to participate in that. And another milestone. So we've been working with UW Extension, partnering with Pepin County and Buffalo County on it's a UW Extension reentry grant. And the grant, roughly around $16,000, but the UW Extension they're the managers, the fiscal managers for that grant. But we have a Pepin County officer who is helping conduct some trainings, and we did surveys over the past year. And really, it's about a number of things and working with law enforcement. I kind of focus on reducing the recidivism, and there is a piece for that within our office, as well as those that we're trying to reach, so that those early intervention and actions that we're trying to make sure that we pass forward to law enforcement, and it's more credibility comes when you have one of your own given the training. So that's why it was nice. We have Corey Kavanaugh is the officer's name, and he's also a veteran. And so he did the presentation to Pepin County law enforcement first. And so it was a nice group. And we're my counterparts in Pepin and Buffalo County also participate. And I'm working on getting the training scheduled with Sheriff Bigg in the Menominee PD, which they're open to once we get past the holidays here. And so in the end, from my perspective, it's about being a part of the solution. So we can maybe, if they can pass on our information, what we can offer, there's a strong chance that we may have access to resources that can help maybe stabilize and ensure they don't have another police contact. And then also, of course, in the big umbrella, it's really to save lives, because if people are heading down that road of law enforcement, I think, and don't quote me on this, but I believe usually when you start to have some of those contacts with law enforcement, that's just a symptom of a larger problem. And if we can be part of that, those solutions, we want to do that. So there'll be more to follow on that. I know I've briefly kind of given some overviews on that project, but we'll be getting our training, and we'll also be Miss Campbell with UW Extension she's going to be trying to get something scheduled with our local CJCC too, but we're focusing on law enforcement right now. And so on the state benefits and federal benefits, as I'll scroll down, I've got in the packet that I sent out, and I thought it was very, very nice recognition from the National Association of Counties, as well as the Wisconsin Counties Association. Number one, to recognize an important day, regarding freedoms. But then the other part is to support the activities and see the importance of what a service office can bring to the county. If you have that one specialized group working on pulling in as many benefits as you can for your local community, that really can strengthen the community. And so both of those articles are attached. And I think each of the board members, I think you guys get the Counties Association magazine as well. Nothing significant financially for office. Of course, we're hitting this last quarter of the fiscal year. And foresee no challenges as we close out this fiscal year, and we're still running as normal. And I think the local community and the veterans certainly appreciate being able to have access to face-to-face services. No questions regarding that. I'll actually move into activities report, and I'll scroll down past those two articles and kind of blow the impact statement up here. So if you can't read it on your own screen, this will hopefully help. Again, just I think it's important to provide an impact statement so we can kind of humanize some of what we do and put it in real terms, impact. And of course, there's all kinds of great, wonderful things that happen within all of the departments within the county. This is just our little piece. I'd been working with a veteran really when I first started back 2014. 2011 as I came on board. The veteran was in the country of Vietnam, and I've talked probably every month about Agent Orange and the impact on so many of our veterans. Really, it comes down to just being poisoned. And now through research, to learn a lot of the effects of that. Esophageal cancer is one of those conditions that was left out of a presumptive disease list, even though by definition, the respiratory system starts with the mouth and kind of goes throughout the body. The VA kind of slices off. They believe that only larynx cancer is a presumptive disease, not esophageal. And so we got to do a lot more advocacy and research. And so it's been a 7-year process with the VA. Very pleased that here this last month, we finally got the outcome that we were after. And I know we've provided some numbers in the past of, hey, like a $90,000 back pay, $120,000. It's all relative, and really when you're talking money, because it's in the terms of a dollar for one person means a hell of a lot more for a dollar from another person down the street. And for this family, this amount of money was an absolute game changer with a safety net, because when you have your primary breadwinner that is recovering and dealing with significant cancer, it has a large impact. And so they're very, very happy, very well deserving patient, great family to work with. So I was very happy of the outcome. We got more work ahead of us, certainly, because there's some other things we need to work on. But that amount, that impact, and their ongoing monthly amount that they'll be receiving is, we'll give announcements to people like, hey, you're going to be getting $1,500 tax free a month, and they're appreciative and stuff. But when you tell somebody, hey, you're going to get about $600 a month, and they're emotional about that, because that $600 means everything to them ongoing. So that was significant. We already talked about activities with the neighbors of Dunn County, and and honestly, that group that really deserves that recognition more than anybody is those that are later in life. You always need that extra pat on the back and support to let you know that everything's gonna be all right. And so it's always nice to participate in activities like that. Another thing, I was asked to provide a continuing education class with our state association. We have to do so many continuing education each month to maintain our accreditation and activity as veteran advocates. And so I'll be conducting a class on the initial claims process, but I always throw my little touch into it on what's important when you're working with people. So I make sure that I go over different interview techniques and how you are able to do the best job to get a full picture of the impact of the disability that they're dealing with, and that customer service and making people feel comfortable and respected during this process, especially with the questions that we end up asking and things we discuss about medical conditions, and really our roles and responsibilities as a county veteran service office. It's larger than just representing veterans. We're representing the county as a whole. We want to make sure that the county is viewed with respect and confidence and stuff throughout the community. Any questions regarding any of the reports so far before I move into revenue and expenditures?
No, Greg, but I would like to point out to the board that County Manager Miller sent an email to county employees on Veterans Day, noting that he had received a handwritten letter from, I believe, an Air Force veteran that Greg had been working with, and expressed his appreciation and wanted Greg to be commended for the work that he does on behalf of veterans. And if you hadn't seen that, I just thought that the committee would like to know, and we express our appreciation for this work, Greg. Thank you.
Yeah, thank you. I'd seen the, again, I kind of knew because a veteran dropped off a letter and said, "Don't open it," to my coworker, and she told me she was ordered to take it upstairs. But we work with a very, very, very grateful population, and Jessica and myself, we never take that for granted. People are generous. We're lucky to be in the location where we are.
Well, and thanks for the hard work.
So moving on to the expenditures and revenues, I really don't have. I could take up 5 minutes to talk about some line items and stuff, but we have a small budget, as I say, that, and the expectation should always be that we manage everything within that budget. I see us doing that again this year without any concerns at all. So I'll be open for any questions if anyone has that. And I think Jody, you were over at the Neighbors of Dunn County for the celebration. Correct. It's different with the mask. I see your face now. So
yeah, I just wanted to say, Greg, that it was very well organized and it was moving and it was special and we enjoyed it a great deal.
Thank you.
And then I didn't know, is it your group that is raising money for the Thanksgiving dinners for vets?
No, not that.
Okay.
No.
Okay, just wanted to check.
Okay, all right, thanks. That'll conclude my report if there's no further questions.
I got one question, Greg.
Yep.
Go ahead, Larry.
I'm not familiar at all as far as benefits that veterans receive as far as, and I'm trying to think of are they EBT cards, the new food stamps? Are they eligible for anything other than just income levels? And also to Chris on this, are those cards value being adjusted with this very large increase in the cost of food and articles about food insecurity with veterans? And where are we at on that? Any comment?
Yep. Chris, I can start with my answer, lead into you, if that's all right.
Yeah, go ahead, Greg.
Okay. So with there are a number of programs that come from the Veterans Administration that are means tested, and that's the food share program that you kind of mentioned, that the EBT card, and I'll let Chris talk more in depth about that. It's one of her programs, but certainly on the veterans side, if it's income based, they can receive a number of benefits, certainly from disability compensation to a pension due to disability. But if on the other side of it, they would be eligible for one of the food share program that Chris, even Badger Care for that matter, the Medicaid program, because it's a whole separate means tested program. On the part that we see in the media, there's a number of things that have come out regarding active duty troops not having enough to get by, and that honestly that has been that's always been an ongoing issue where and part of that is on the active component. People are doing you'll hear the acronym PCS. It's a permanent change of station. And so if you think about, if you're a spouse supporting your the veteran who's serving, that spouse really, as far as employment, is secondary. And so because getting into a career is very difficult. So that's why they're working a part-time job or just manage the kids, because in some of these communities, they're not going to hire somebody that they know is going to be moving in 2 years. And so I think from my perspective, that's where some of that food insecurity does come in, because the cost of housing is different in Hawaii versus out at Fort Bragg and in Carolinas. So hopefully that answers your question. I'll hand it off to Chris.
Thank you.
So food share recipients in Wisconsin have been receiving an enhanced food share benefit throughout the pandemic. And then the federal monies were permanently increased in October of this year. So it's a little unknown exactly how that will all settle out once the pandemic is over and what those numbers will revert to. But we've talked about this a little bit before. They are a significant increase. They're not related to the increased food costs or the inflation rate right now, but they are related to the pandemic. So typically someone who was a household of one would have received any place between $17 and $170, I believe, in benefits. And right now they're receiving $250. But at some point in time, that is going to readjust for them after the public emergency is completed, and they will revert to some lesser amount, although I think it remains to be seen what that amount will be.
Thank you.
Thank you both. Are there other questions or comments for Greg? If not, thank you for a good report, and we'll move on to the Department of Public Health. KT.
Good evening, guys. So I did send out some handouts right before the meeting as well, and I'll talk through those as I normally do. I do want to start off with what's good. I've tried to just kind of ground myself in a little bit of gratitude as things are challenging. So this last week, we are really trying to buoy spirits for our team. So we did a training on prevention of primary and secondary trauma, really thinking about the ABCs of resilience. And so we spent 2 hours, turned off all the phones. Of course, we returned the phone calls later, but just spent time together in Zoom with a birth to 3 director in the region who did her master's degree on resiliency. And so was able to bring her in and give some folks some real tools to center into balance. And so I think that was really well received. We also had a visit from Rookie, the emotional support dog from the sheriff's office. So it's really hard to have that anxiety or that difficulty of sitting too long when you've got a 100-pound curly-headed dog in for Boop Snoots. So it was really, really good to have a rookie in. And then, so that was definitely good. Additionally, we have both of our new environmental health staff on board, both the environmental health manager as well as the environmental health specialist. We've sent out introductions for both of them to our licensed facilities so that they know who's who and where those contacts lie. And so we're really hoping to get back into our regulated facilities as a partner and a support for food safety, for water safety, and follow up on human health hazards. So that's really what's good. I would also share that what I sent you to start with the respiratory report, I'll go ahead and share my screen. The respiratory report is also fairly good. We are seeing what will be a likely normal year with influenza. So starting to see some positive influenza PCR tests come back. We are seeing that surveillance is much lower than what we continue to see with RSV and other cold-like enteroviruses. So I think that that's positive. There is some reason for concern. If you guys are following national media, there was a significant outbreak of influenza at University of Michigan. And so something to definitely be aware of as we continue to push and encourage and outreach around influenza vaccination as a way to keep illnesses at bay as we expect a more normal flu year. So that's what's good. So as far as COVID goes, the department is consumed again by COVID. As you can see, the northern areas, Michigan, Minnesota, and Wisconsin, we are very much at or I guess the highest levels this year. So going back to last November with our case rates, the southern states have kind of calmed down, but we are definitely continuing to see the highest rates that we've had this year. So this last week is our highest week this year yet with as of today, we had 333 cases in 7 days. So that puts us at about 47 cases a day for a 7-day average. That is very much in line with what the state of Wisconsin is seeing. To think about our peaks and valleys, this is by symptom onset. So this grayed out area, I'm gonna update, is still preliminary data. So oftentimes people will get tested because their employer wants them to get tested when they're done with what should have been an isolation period, or mid symptoms before they're like, yeah, it's not a cold. I lost taste and smell. I'll go in and get tested. So it's still definitely going to increase in this gray area just from the number of cases that we're seeing. We have jumped over 7,000 confirmed cases, just to show you guys where we are here in Dunn County. Confirmed cases, oops, it's gonna reset again. As a reminder, confirmed cases are PCR positive cases. Probable cases are antigen positive cases. We are also seeing a resurgence in family members, specifically with small children that don't care to test their children, and they have a positive in the household. And so those kiddos, if they're symptomatic and in a house with a positive person, are considered probable. You'll see that those are relatively much smaller numbers than our confirmed cases. We are working with those families to get them either a saliva test or something less invasive, like just in the nostril, to get tested. So that way those children won't have to quarantine if they're exposed in the next 3 months, because we do believe that there is a fair amount of natural immunity conferred with infection. And the state does allow for 90 days where they would not have to quarantine again. So what does this kind of equate to in activity? So if you look at Wisconsin, we are at critically high in Dunn County. So the state for 2 weeks is how that they count those numbers, is at 767. Dunn County is almost double that right now as a rate for 2 weeks. So the concerning component of this is really the cases are concerning, I'm not gonna lie, but the percent positivity is really what gives me a significant amount of heartburn. So anything over 5% is considered indicative of community spread. And right now we're at 17.8%. So, more than, 1 in 6, 1 in 7, or 1 in 5 cases that are being tested. People that are being tested are coming back as positive. Deeply, deeply concerning. And we're moving into holiday season where people are quite done with COVID. They don't want to think about it. They want to get back to normal, even though the risk is substantially higher, especially for unvaccinated people, which is really what's, again, continuing to drive our cases here in Dunn County and in the state. We're seeing cases, a real change in our case demographic, again, where we are being driven by cases in children, K-12 and younger. And then we're seeing breakthrough cases in family members after a household contact. We do see additional breakthrough cases in other folks, but the vaccine is still incredibly protective, not only against infection, as you see with this infographic from the Wisconsin DHS that shows that as a rate, not fully vaccinated people are about 5 times more likely to get infected, 10 times more likely to get hospitalized, and 15 more times likely to get to pass away. So that case data, or that rate data, is still incredibly important. Unfortunately, the state has stopped, for whatever reason, updating their vaccination rates. There was a transition where they were trying to update their infographic to include vaccination rates in children under 12. And something happened, and they have not met their metric or their date for a rollout on getting that updated. And as a result, we're sitting with data on the Wisconsin DHS that is back from the 5th. I did meet with our local superintendents this morning, as we do every week, and we'll get them a report out of the Wisconsin Immunization Registry on our updated immunizations, and I will provide that to the board as well, so that you guys have a sense of where our local immunizations are. But we do continue to lag substantially behind the state, and we have stagnated in our 12 and older population as far as initiating the vaccination. We are seeing boosters, and we are absolutely encouraging people to get their booster. If you have a high risk because of your own health profile, or you have high risk because of where you work around a lot of people, we encourage folks to update their waning vaccine-acquired immunity with a booster. We are opening boosters to children at the health department starting next Monday. We have slots available that we'd like to fill with parents that want to get their kiddos vaccinated and can come in with them. There is some concern in the community that if people want to be vaccinated in Menominee, that the wait time is a little more substantial. If they're willing to go to Eau Claire or Barron, then they can use where they doctor, would have to travel. And so we're hearing that some folks that have been trying to get vaccinated or get their children vaccinated have to wait until early next month. And so we're trying to step in and help bridge that gap. So that was a really long ramble. Any questions about either the good or the not so good here in Dunn County Health
Any questions for KT? Dr. Hall? You are muted. There you
Yes,
are.
sorry, I wasn't ready to go. Hi, so thank you for all of your work. So given the announcements from the leadership at HSHS and Mayo and Marshfield yesterday or the day before that, you know, they're really full. And in today's report from the Wisconsin Hospital Association, there are 0 ICU beds in the entire Northwest Wisconsin region that are currently available. And my understanding of the situation in hospitals often is that it's not always lack of physical space, but lack of appropriate staffing to then actually care for someone. Is the state, I mean, given that our case rates are going crazily up and that there's a delay from when cases happen to when hospitalizations happen, so we probably have a couple of weeks at least of increasing hospitalizations baked in already at this point. Is the state looking at using National Guard or other medical support, you know, to help with anticipated increased hospital needs? You know, we had that temporary field hospital that never got utilized much last year, but I'm just wondering if there's any talk going on about how to support hospitals because it's likely to get worse before it gets better.
So there has been some conversation about National Guard support, specifically in long-term care and other places where they're anticipating a staffing shortage as they work to meet the CMS guidance on vaccination or mandatory vaccination. But I have not seen one for hospitals specifically. Our hospitals are still conducting elective surgeries, and oftentimes that's the next step. The challenge for hospital systems is that is really where they are able to make some money to offset some of the extreme cost for these prolonged hospitalizations in places like with COVID. So I haven't heard of them declining elective surgeries yet. That's the first step. But then I do know that the state has mobilized around other places with extreme staffing shortages. My expectation is that they would also do the same for hospitals. But you're absolutely right. We are expecting a pretty extreme next couple 2 weeks, not 2 weeks, more than that, several weeks through the holidays, because hospitalizations are a lagging indicator. One of our staff members had a family member that had a very significant break to a bone, and they waited in the ER overnight, and they were talking about transporting to North Dakota because that was where the closest that they could send them. So it is very real. The shortages are very real, and the tightening of both bed space and the people to man the beds here in the Western Wisconsin region, as well as throughout the state.
Other questions for KT on the status report? All right, KT.
Okay, so let me pull open the finances and then share my screen again so you guys can see that. Okay. So you guys have the expenses in yellow and the revenues in green and blue, and I scrolled down a little too far. So looking at our grand total, just starting with the big picture, recognizing that things still are shifting as we have a couple very large CARS amounts to come in. So when we bill the state for grant work that was done under our consolidated contract, it's in their CARS system. It's an acronym for something I can't remember right now. So there will be some shifting, but we do anticipate that we will, with the grants coming in, to offset some of the lack of revenue for program generated income, have some return to the general fund. Does anybody have any questions on a deeper dive either in our revenues or our expenses for the health department at this time?
Any questions on finances for the health department or anything, Sarah, that you would like to add?
The only thing I'd like to add is CARS's community AIDS reporting system.
Thank
Go
you
ahead.
so much, Sarah.
Thank you, Sarah.
Welcome. Otherwise, no.
Okay. Any further questions? If not, thank you for the good report. And I'm glad that you have had at least a small chance to do a little celebration. All right, anything else? If not, moving on to the Department of Human Services. Chris, the ball is in your court.
All right. Well, I'm going to spend my time today with the revised or updated PowerPoint that I did for you almost 3 years ago. And so some of you will not have seen it. And then we're going to walk through the Comprehensive Community Services Program. We've talked about this program a lot because it's grown so much and we've added staff and all these different things that have happened. But so I want you to have, again, a foundational understanding. And so if you say, well, that PowerPoint looks familiar, which you probably won't, but if you do, it is because by recycling some of it and have updated some of it. So I'm going to share my screen as well. Do you see that?
Yep.
All right, never quite know. And I know that if I try to make it into a slideshow, it disappears on me. So you have to look at it in its smaller form. So Comprehensive Community Services, we call it CCS. CCS is a community-based program as opposed to like a residential kind of a program or a place where you go to live, you obtain the services in the community. It's voluntary. It's recovery oriented, meaning that it believes that people can get better from mental health and substance abuse issues and can recover. And it's self-directed, meaning that participants have to be people who are able to have input and direct their own recovery. So I have to be able to say, these are the things that will help me to be better and to sustain being better. It serves both kids and adults, and participants need to be at a higher level of treatment than just an outpatient clinic would be able to provide. And they have to have not had success with kind of traditional services and be at risk of hospitalization or out-of-home placement. CCS first came to Wisconsin counties in 2005. It is a Medicaid program, a Medicaid certified program, meaning we have a license to do it or a certification. And as in typical Medicaid programming, the federal government provided 60% of the cost reimbursement for every dollar spent, and counties paid 40 cents on the dollar. So in 2014, Governor Walker, in a biennial budget proposal, incentivized counties to form regions to deliver CCS by providing 100% cost-based reimbursement, meaning that instead of the county providing the 40% on a dollar, the state now provides that. But in order to do that, you needed to form together. And there were a number of different ways that were articulated as ways that you could form together for consortium for delivery of the CCS services. So I'm going to sort of step back and I'm going to give you a little bit of history because there's other great information in here about sort of some of the history of what we've done in the Western region of Wisconsin. So back in 2005 again, 4 Western Wisconsin counties got together and they said, like, how can we do better at what we do? And how can we hit the needs of more people and grow? And so at that point in time, they focused on crisis services, and they developed a public-private partnership with Northwest Connections, which has grown now it started out with 5 counties, St. Croix, Pierce, Dunn, Eau Claire, and Chippewa. And now I believe Northwest Connection serves 28 counties. There are some other providers as well in the state. So this small group received grant services to help to get going to develop crisis services in Western Wisconsin. In 2009, 7 counties, now we've grown from 4 to 7, got together and started to talk about some service gaps that were in for kids and adults. And the Western Wisconsin Recovery and Wellness Consortium was formed, consisted of those 7 counties. We developed a way to find resources for kids in need of placement called the Children's Services Crisis Network, which matched placement resources and kiddos. And then in a year later, the Department of Health Services contacted us and said, hey, we've got a bunch of money. Would your consortium, since you're already formed, be interested in piloting doing an employment program called Individualized Placement and Support? It's an evidence-based program developed out of Dartmouth that aims to get people who are experiencing mental health or substance abuse issues working in competitive employment as quickly as possible. So typically, employment programs have worked in a way that you worked your way through maybe a sheltered workshop and then maybe a job shadowing and different kinds of activities to show your work readiness. And this program is aimed at, if you want to go to work, we're going to help you try to find a spot to go to work. So that program was funded and developed in 2010. And then in 2011, we were offered an opportunity. Well, we did a proposal for it was a system innovation grant. It was $200,000 a year for 3 years. And again, we were poised as a system to be able to take advantage of that grant and look at some additional ways to enhance our system. In 2012, we worked together to develop a 4-bed adult crisis stabilization home in partnership with Aurora. It's located just north of the Sleep Inn on Highway 29 and is utilized a lot. And then in 2013, we were awarded the 3-year $200,000 grant, and that allowed us to work together to take advantage of the enhanced funding in CCS for CCS in 2014. So we took about a year to put together. It's a very administratively complex program. Lots and lots and lots and lots of rules or requirements. So it took us some time. Chippewa County is the lead county, and they hired an operational administrator for that program, and they do all the billing. They host the electronic health record that the program is run from, and they have all of the administrative supports necessary to pull off the program. And so we received our Medicaid certification in April of 2015. There's 2 parts to CCS, and I will tell you that it's confusing even to our staff. So it's sort of like I have to tell you to put on one hat and take off another hat. So one hat that you put on is we as Dunn County are part of the Western Region Consortium to be certified as a CC in the CCS program. We hold a licensure or certification to have a CCS program. And a part of that is that we employ many service facilitators to do assessments and service planning and coordinate those the services that are delivered. We also, but not every county is this, we also can be a CCS service provider. So our outpatient mental health clinic and a couple of other ancillary types of services are also we are also a provider. So we contract with, or Chippewa County contracts with us to be a provider of CCS services as well. And those include outpatient mental health and psychiatric services, something called independent skills development, some employment specialist kinds of things. So there's kind of two sources of there's two pillars that happen within CCS, and they both contribute to what we do within CCS, but they also contribute to the revenue. So as an example, as a provider of CCS services, like in our outpatient mental health clinic, we submit a rate to Chippewa County every year that that covers our full cost of delivering that service. So as I said, often in Medicaid programs, this federal government pays 60%, a local match comes up with the 40%. So maybe we provide outpatient mental health and it costs $250 an hour for a therapy session. That's our true cost, but Medicaid sets a rate and then they give us 60% of that. So we maybe for a $250 service, maybe recoup $60 to $80. If that, sometimes it depends. So as a CCS service provider, we send the $250 rate to Chippewa. And when we deliver that service, we bill Chippewa County $250 and they pay us $250 back. So it's full cost-based reimbursement. So this is the kind of exponential growth of that program. And this has been reflected across our now 9 county consortium. In 2015, when we started in April of 2015, we had 1 service facilitator and 0.1 manager. So somebody who was spending less than 20% of their time, 10% of their time in the CCS program as a manager. By 2016, we had moved to just under 3 service facilitators and had moved up the management to that. And we're serving 51 persons. And you can see the kids on the adult breakout. By 2017, we had gone to 5 service facilitators and now almost a full-time manager, and we're serving 72 kids. By 2018, we had 7 service facilitators, same manager, 101 kids, or 101 recipients. 2019, we had 10 service facilitators and a manager, part of a manager, for 119 recipients. In 2020, we added an intake worker. We had 13 service facilitators and went to 1.2 managers, served 129 people. And so far in 2021, we have 1.6 intake people, 12.4, we did some shifting around, 12.4 service facilitators, 1.5 managers, and we're serving about 200 people. So that is reflected as well within the consortium. So at the beginning of all of this, we had to sort of say, how many people do we think we're going to serve? And so we said, oh, you know what? We did some thinking and calculating. We said, we think we'll have about 50 people in the CCS program. Well, as you can see now, 7 years later, we're at 200 people. And there's no sign of that it's lessening yet. We are still in a growth pattern.
Chris, can I ask a question about the the fairly significant growth in consumers between 2020 and 2021? Is there what do you attribute that to? I didn't run the numbers, but
there was a lull. So I think there was it was going up, and then I think that there was a lull when COVID struck in early 2020. In fact, such a lull that we were looking at adding some service facilitator positions and we held off because things really kind of settled down. And if you recall, we had a lot of conversations about one of the components of CCS is that by our certification, we're not allowed to have a wait list. And we had a significant wait list. So some of that is in the lull. we were able to move people off of the wait list and into service. So we have a very small wait list now. We had about 80-ish people on our wait list, and we have about 15 now. So some of that was that, but also there was a lull. And then after that lull passed, people have a lot of needs right now. I think probably a large portion of the population would probably identify as having some mental health concerns or needs. And so there just has been a dramatic increase in the number of people seeking services as well.
Thank you.
So now we're going to pop a little bit into just the concept of rate setting and why this program is so unique. So whether you're running a CCS program or you're going to open a coffee shop downtown, or you're going to open a gas station or whatever you're going to do, the concept of how you set a price for your product is kind of the same. You add up all of what you anticipate it's going to cost you, your staff, the management, the supplies, the overhead, what does your building cost, what does your toilet paper cost, what does your water bill cost, all those sorts of things. And you divide it by how many of whatever you're going to sell you think you're going to sell. So if you're going to sell coffee, you're going to divide it by how many cups of coffee that you're going to sell. And then that's going to help you set the rate for how much each cup of coffee costs. Obviously, I'm simplifying this, but it's really the basic concept is you take all your cost and you divide it by how much business that you think that you're going to do, and that gives you a rate. So we set a rate based on our anticipated costs and our anticipated billable hours for the next year. Then Chippewa County adds to that rate their administrative costs. We deliver the service. Chippewa bills Medicaid for the service. Medicaid pays an interim rate to Chippewa. Chippewa takes off what their costs were and sends the difference to us. Then in July of the following year, the county submits the actual cost. So now we were anticipating costs when we set the rate. Now we tell them what did it actually cost us. And December of the following year, they make us whole for whatever we had in the program. So you will see when we get a little bit farther in the presentation that our reconciliation numbers as the program grows have also been significant, have grown significantly as well. But that's the basic. Now this is us as a participant in the CCS program, not as a provider of mental health services, but as a participant, part of the certification. So the reconciliation looks at three things. It looks at our direct cost. Who are the staff that are delivering this program? How much are you paying them? What are their fringe benefits cost? How much in travel and training do you have to provide to them? It looks at our what we call AMSO, Agency Management Support and Overhead Costs. That's a little bit of me. That's a little bit of finance. That's a little bit of our clerical supports. That is a little bit of our mail and our telephone systems and our IT licensing and paper and staples and paper clips and all of those sorts of things. And it says what portion of that is this program consuming? And then the last thing it does is it goes even bigger and it says, all right, if you are a Department of Human Services and you're providing this program, then some portion of all county operations are also attributable to this program. What does your IT program cost? What does your corporation counsel cost? What does your county administration cost? What are those entities in your county that serve all the departments? And what is your department's portion of that? And then what portion of that gets filtered down to the CCS program? And we get to claim costs on all of those things. So you'll see here in a moment why that starts to matter. So this is was what the government promised, what the state promised to do, did that actually materialize? And so this is kind of a comparison of what things have looked like for us. I did not include reconciliation for 2015 because one, it was a part of a year, and two, we were not working with, we started our work in SAP in 2016, so it's easy for me to run comparative data. To go back to 2015 just gets to be more complicated. We were not fully reconciled for 2015. It was close, but we weren't. We learned some things about how to claim our costs, how to track our costs in that first year of operation, but the program was also very small in that year. And so you can see here the growth of the program. So I show you the year and then the cost of the program in as recorded in our system, then the cost as reported in what we claim in the cost tool, and then what money we had received by year end, and then what we were reconciled to. So in that first full year of operation, by the end of the year, we had received 71% of our total costs for the program by the end of the year, by the time we closed out our year books for that year. But by the time that all the reconciliation had been received, we had received not really 105% of our costs, but that 5% includes those pieces of management, those AMSO costs, and more so those indirect county costs, the cost of the county administration, IT, corporation council, facilities. So we were essentially reimbursed over our internal costs by an extra 5% to cover those costs. In 2017, then you can see the program grew. By the end of the year, we had received 86% of the total cost by the end of the year, and then ultimately reconciled at about 115%. And again, I want to emphasize this isn't about the county made money. It's how our financial system tracks things. That portion of all of those big county costs are not tracked directly to the CCS program. The portions of me and the portions of Sarah and the portions of our clerical staff in SAP are not captured to CCS. So when I'm going to go back to 2016. In 2016, when it says $248,000, that does not include the little bit of me, the little bit of Sarah, and the little bit of toilet paper, and the little bit of all of those other things. So when we get made whole, it's making us whole for all of those things. So then you can just see the growth. So in 2016, we had $248,000 in the program. By 2020, we completed our cost tool for 2020, and we're at a little over $1 million. And because we are not reconciled for the previous year until the end of the following year, we book that revenue into the current year. So when we receive our reconciliation payment in December of this year, it will go into this year's revenues. So last year we spent a little over $1 million by the end of the year in the program, and we received a little over $1 million. These are not the same numbers. I had to look at them several times to say, what the heck? But they are 1,059,623 and 1,059,450. So I guess we were not made 100% whole by the end of the year. We were $73 short. No, I guess $173 short. So what are the takeaways to all of that? One, I didn't put this on here, but one, I wanted to show you that the promises of full reconciliation are true. And when I stand in front of you and say, we're adding staff, we're adding staff, we're adding staff, that we're paying for those staff. And I could have flooded you with more numbers to show you what we pay for, what we're able to pay for in a year. We essentially can cover all of our service facilitation costs in the year in which, I guess I say that a little bit here, in the year in which the costs are incurred. What we don't cover all of is all of those extra pieces of me, pieces of all of the county, rest of the county. Those we wait for reconciliation. So the key takeaways are that we have had a long and a successful history of collaboration with a lot of Western Wisconsin counties to deliver quality services, and we're proud of that. We have partnered in a number of shared initiatives. CCS is voluntary, it's recovery focused, and it's aimed at reducing the likelihood that consumers will need deep end services. The certification requires no wait list. It is the only behavioral health program, it's the only program we do that has 100% cost-based reimbursement. CCS funding is funding services that would otherwise be funded by tax levies, such as youth justice services and behavioral health services. So if we have a youth involved in our system who's in need of some specialized therapies, or they're in need of a youth mentor, whatever those services might be that we wrap around them, we often are able to enroll those youth in CCS and bill that cost at 100% cost-based reimbursement back to the CCS program. So between January of this year and just September, 131 people were served. And you'll remember I said 199, we've got about 70 people in the works. So, but 131 people were served at an average monthly cost of about $1,335 per person. Now that includes everything they're receiving. That means if they're going to therapy, if they're going to involved in some sort of specialty supports, whatever they're doing, it's costing a little over $1,000 a month per person. We also fund, the CCS is also funding more than 14 full-time benefited positions and many other service providers across our county and the consortium with zero levy. And in spite of our exponential growth over the last 7 years, we have been able to cover all of our direct staff costs within the year in which they were incurred, and then waiting till the end of the next year to cover those indirect costs, like the pieces of me and Sarah, etc. So it's a pretty amazing program, and it has some pretty amazing outcomes. And has surpassed anything we would have thought about. So, it is also covering, you know, we have some billing people who bill Chippewa County. It covers whatever portion of their time is utilized in billing. We have mileage for staff to go out and see people. It covers their mileage. We have cell phones and laptops and desks and chairs and those sorts of things for the service facilitators. It covers those costs all at 100% cost-based reimbursement. And then, like I said, it covers a little bit of me and a little bit of all of the other supports within our system as well. So that was a lot of information, but it is such a big program that I just wanted you to have another sort of big picture look at it all. Can I answer any questions?
Are there questions for Chris? Supervisor Bjork?
Chris?
Yep.
That was a heck of a presentation, but I've got notes here and I have questions.
All right.
Follow through this, and it's services provided to CCS. Had a lot of growth. CCS outpatient provides behavioral health programs and is recovery focused. You went through how the program has grown, but you didn't spend any time on the percentage of people that we serve, you serve, CCS serves, that somehow graduate from the program or have achieved a status where they don't need the program anymore. You know, shouldn't this be judged a little bit on the success of the people that have able to leave the program and spend all this time on discussing the program growth. Art?
Sure, I think that's an excellent point. And there are those numbers are available. You're right. I didn't capture them in this PowerPoint, but I definitely could illustrate the ins and the outs and some of the successes of that programming. And people have some kind of amazing stories too about how helpful CCS has been with them and been for them in stabilizing their lives and helping them to be able to be, employed, productive members of our community. But I will definitely find that information for you.
Well, I'd like to hear about some success results. And I don't know, for a program to be successful, it has to have successful results. And I'd like to hear about a few. Thank you.
No problem.
And thank you for that, Supervisor Bjork. We'll either get to that next month or January, if that's okay.
Yeah.
Are there other questions for Chris about CCS or anything else? Yes, Chairman Bartlett.
The numbers that you on that slide that grew every year, and I think there were like 199 this last year. Is that just in Dunn County, or is that what you're providing with that other service to other counties?
No, it's just Dunn County.
Okay, thank you.
Anything else? All right, moving on.
Sarah, I believe, is gonna do the financial report.
Hi, everyone.
Hi, Sarah, thank you.
Yeah. I'm going to see if I can share my screen. Can you all see that?
I can.
All right.
Everybody can? All right, thank you, Sarah. Go ahead.
Yep. I will start with everybody got the copy of the spreadsheet. I'll just go to the bottom and do the summary piece. The grand total of our expenditures is $12,514,466. We divide that out for operating and then salary and fringe. Our operating is $7,724,654. And our salary and fringe comes to $4,789,812. And those totals foot back to the $12,514,466. Our budgeted projected revenues are $9,395,225. With all the fancy math that goes into it, we look like a projection of we're going to use $3,119,241 of county levy. That leaves us with a projected total to give back from our $4,178,916 allocation of county levy of $1,059,675,000. I'm sorry, $1,059,675.
Sarah, these data are current through
It would be the
September.
Yes, you are correct. And
Thank you.
revenue through August.
Okay. All right. Supervisor Steen isn't with us. Are there questions for Sarah?
Sarah?
Yes.
Supervisor Bjork.
So how much did we pay house calls of Menominee in this month?
It's in the vouchers, which you're going to look at in a minute.
Yeah, they're all in this report. They're all separated into the cost centers in which all the people and employees are divided up.
Thank you. I can wait.
Okay.
All right. We have an action item, but before we move on, we are blessed to have Assistant Corporation Counsel Barbara Fagan with us. And I don't know if everybody knows her. She's terrifically talented. And did you just join us for fun?
I joined, thank you for the privileged to speak, Chairperson. I joined because I think that it is a very important board and that it is an important part to our county board, and that the more I know, and I'm an integral part in a lot of things as far as mental commitments and the guardianships and things that are involved in it, that it made a lot of sense to start joining these meetings.
We are delighted to have you, and you're welcome anytime. Thank you.
Thank you.
Okay, we have one action item, and that is consideration of the vouchers for October. I need a motion to note review vouchers in the amount of $343,585. Mr. Lamb moves. Is there a second? Ms. Barker, seconds. Any further discussion? Supervisor Bjork.
I would sure like to know why we seem to have this conflict with identifying where the money goes to house calls. The first time I brought it up, they reduced the print on it. And you suggested that I get a magnifying glass to read it. Brought it up again. We printed the names of where the money went. I kind of thought that's what we were going to do. And then it switched back to the way it was. And then we're told that we're eliminating, after 30 years, our work with House Calls of Wisconsin, or House Calls of Menominee. And why can't we identify where the money goes?
Larry, can you be more specific? Because I'm not sure I understand your question.
Okay.
And can I, again, Ms. Supervisor Bjork, if I may interject, last month, I believe you wanted names. Is that what you're interested in? I'm not sure. I'm with Chris. I'm not sure I understand what the expectation should be.
Well, there was one month when you printed the House Calls of Wisconsin, House Calls of Menominee, Wisconsin, Incorporated, agency contract. And for example, instead of printing, $2,732.80 on the first page, you had somebody's name on there. Now, what's wrong? What's wrong with knowing where the money goes and who it goes to? And then, did that have something to do with the problem that came up that we had to not work with them anymore? I mean, I thought it was pretty serious when Chris stated last month that severing ties with House Calls of Menominee because of IRS issues, because of Wisconsin retirement, and I can't remember the third one. And I think it's just being hidden. I mean, I don't even, am I supposed to know how much money we spend with House Calls of Menominee per month? Am I required to add up every one of those columns, every one of those expenditures, so that I know what it costs? I mean, where does the money go, and who does the money go to?
And as Supervisor Bjork, as Chris has pointed out, it's entirely salary.
So who are we protecting by not putting somebody's name on the dollar amount?
Well, I don't know that we're protecting anyone. We don't put all of the names of who receives we put business names. Sometimes businesses are individuals. So sometimes you will see an individual's name. Sometimes our vouchers also reflect that we've made, for instance, a restitution payment or some other transaction with someone, an individual. But as a general rule, most of what you see on the vouchers are businesses, and House Calls is the business.
Well, that is incorrect, and what you just stated. because I'm looking at a page right now, and electronic monitoring for Judy Peplinski. You've got congregate meals for Karen DeSmith. You got home delivery meals. I can go on and
Right,
on.
but Karen is she is our vendor who transports meals, and her business is her name. You can either have set yourself up as a corporation or some form of a formal business, or you can have be identified as you can be an individual who's an independent contractor. Karen is an individual contractor.
Okay.
Mr. Lamb, go ahead.
Maybe this is just a question, but maybe this will help Larry. And I don't know the answer to this, but I'll ask it anyway. Like house calls, for example, we had a contract with them, or maybe we still do, but I don't think the county directly paid their employees.
No.
It did not pay their employees?
No, we paid house calls.
We pay house calls.
Yeah, that's my.
That's our
question.
contract is with house calls, not with those individual service providers. They are employed by house calls
Well, then that's my misunderstanding. I thought that the dollar amounts that were given here for agency salaries and travel were made to an individual, but they're not made to an individual. The 1 month you had an individual name there. So I don't know what I'm supposed to think.
There have been individual, as Chris suggested, there have been individual names. There's an individual name that provides IT services, and those are often listed, but those are not house calls.
Well, I think I understand what you're saying, Larry. So you're right. When you look at agency contract salaries, and then it's a number. Each of those numbers are representative of an individual, but they're not representative of paying that individual directly. The money, it's split out so that we can provide you with where is each of that dollar amounts going within the budget. So what's going to this program, what's going to that program. So it's split out by the employees and where they work within our organization, but it's not being paid to them individually. It's paid to house calls, who pays them for the services that they deliver.
Okay. Well, I'd still like to know how much a month Dunn County pays to house calls of Menominee.
I'm just running September for you. Give me 2 seconds to take a look here.
Chris, I have that for you if you want it.
You have September?
I have the last 2 payments we made to House Call. For every 2 weeks of a payroll that House Call bills us, it's about $111,000.
Well, you see, that's all I've ever wanted. I just wanted to know where the money was going. Thank you very much.
Okay, Dr. Hall.
I think, and I had some similar confusion to Supervisor Bjork too when I first came on, and was grateful that it was explained that these are kind of contracted employees, so to speak. They work for house calls because it's cheaper for the county if they work for house calls and we pay them that way than that they are county employees, although they do a lot of the same work that previously county employed folks used to do. But I agree that it would be useful to have we paid this much to house calls of a Menominee because it was this many FTEs of staffing who were doing work for us. And I think we had talked at a previous meeting about how if we could get just kind of a little synopsis like that, to know we paid this much to cover salary and travel for this many FTEs of people who were doing work for the county. I think that would go a long way to making this feel like it makes more sense, perhaps. So I don't know if that's something that can be provided. I don't really know what the rules are for what's provided for these meetings on a regular
You can
basis.
have whatever you can have whatever you want. It's all public record, so it's not. But but I'm a little confused because we did do that. So we did it for a month. If you'd like us to do it for every month, we can do that. It doesn't change dramatically from month to month because they are set staff, but I am happy to pull together whatever is most helpful. And I know that Dr. Hall, you weren't here last month, but our contract with House Calls is coming to an end at the end of this year, after unrelated to these questions, related to exactly as you indicated earlier. There are now there's new legal information and Wisconsin Retirement System and Fair Labor Standards Act information that says that because of our employment relationship, we could potentially be on creating a situation of liability by having this type of a contract for leased staff. So we're bringing that contract to an end.
Okay, is there any further discussion? In case you've forgotten, we do have a motion and a second on the floor to note review of these vouchers. Any further discussion? I don't want to foreclose it. All right, ready to call the question. All in favor, say aye.
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 Any opposed? Vouchers are noted. And unless we have any announcements, we will be adjourned. Any announcements? Stay safe, everyone. Take care. Have a happy Thanksgiving. Good luck, Chairman Bartlett.